Well, welcome back to the channel. This is the Not a Real Doctor DPT, and my name is Eric. I'm a licensed and practicing doctor of physical therapy and have been so for about 12 and a half years now. And for today's topic, I want to talk about what to expect from your physical therapy today. So this is going to be more kind of a generality again. We're kind of working through kind of the basics of physical therapy, and then we're kind of talking about in general what physical therapy is doing, and we're just continuing to kind of niche down on the topic. And today, wanted to just address the topic of what would you expect from a physical therapy visit today? What would be the expectations from that visit if you were in, say, an outpatient setting, if you're in the home health setting, if you're in skilled nursing or an acute care setting? What are some of those expectations for your therapy? So I want to start with outpatient physical therapy because that's where probably the most folks that are going to be watching on this channel will be coming from. So if you are currently an outpatient, what you should be expecting today from your physical therapy visit would be that, this is pretty much an easy one, that you would be taking a step in a positive direction towards treating your condition. An outpatient, that usually is going to be pain. So we are usually trying to help you to decrease your pain. There's certainly is a movement component to that and trying to help you move better. I would say that the main focus for you in that outpatient setting today, if you're going to an outpatient orthopedic appointment, your thought should be, I should be coming away from this appointment having taken at least one good positive step in the right direction on treating this condition. So that could be a couple of different, or that could have a couple of different dynamics to it. It could be, as I mentioned, having pain reproducing, or not reproducing, having pain decrease by the time that you leave your visit. I know that what I typically am looking for is when a person is finishing their visit with me today, that they have that, well, I love having when they have that little bit of recognition in their eyes as to, okay, I understand why I did what we did today. That might especially relate to doing manual therapy, where, especially if it's early on and you're not used to getting a lot of manual therapy, at first, because manual therapy can sometimes be painful, and so a lot of times patients are a little bit unsure about what it is that you're doing to them and why. But what we love to see is when that patient gets up off the table and they start walking around, and then they see there's literally a light of recognition. Excuse me, my son, I was at a baseball game today and have been yelling a lot, so my throat's a little scratchy. Anyway, what we like to see is that you can literally see a light of recognition in a patient's eyes when they get up and they move a little better. They might feel that their hip joint is a little bit looser. Their back is actually moving a little better without as much pain. And then that really is my favorite thing about treating an outpatient, I would say, is then once they have that recognition, then they understand, okay, I see now why we did what we did today. And they walk out feeling better and feeling like, okay, I'm starting to move in the direction that I'm needing to move to heal up this condition. So that's the thing I think that you're looking for from your outpatient orthopedic appointment today. If you have a home health visit today, I think also in that home health setting, you are looking for, again, understanding that you have either been making progress on with what you've been doing, or learning that next new thing that's going to help your balance to improve, that's going to help your um, help your strength to improve, and then help you to move a little better. In home health, we're not going to focus quite as much on manual therapies as we would in outpatient. So in home health, the understanding or recognition that we're kind of looking for and are expecting out of our visits is going to more relate to a bigger picture that, okay, yes, I am starting to feel stronger. I'm starting to move with a little bit more confident. I am not sitting in my chair as much. I am doing that daily walking program. I am moving around better. That's really the I would say the step and the breadcrumb that we're looking to follow in the home health setting with you. It's a little harder to see when you're not doing manual therapy on a patient. Working with a patient on exercise and having that be the main focus. The research certainly bears that out, and you can certainly make progress on that. But it's harder to see that progress on a day-to-day type of setting. That I usually, in home health setting, would like to see a that progression happen over about a 30-day term, even a 60-day term. But usually you can start seeing that progress in about 30 days. So what I would expect that I'm getting from my home health appointment today would be I'm wanting to maybe learn one new thing that's going to help progress me in that positive direction. Maybe one new exercise, one new thing that's going to stand out in my mind, or maybe even one thing that, okay, I've learned one new thing that's going to help make sure that I don't have a fall. That kind of a focus is what I would be thinking about in home health. So those, you're not necessarily always going to have that same light of recognition that you would get in an outpatient setting, because outpatient, especially with manual therapy, a lot of that is like right now type of results. Home health, it's a little more planting seeds and looking for a plant to start coming up out of the ground, and within that about 30-day term, certainly within a 60-day term. So that's more what I would be expecting from a home health appointment today. If you are in an acute care setting, if you're in the hospital, the main thing that I'm expecting with my physical therapy visit today, if I am this patient, is I'm getting out of bed. I'm gonna move this joint, or I'm going to prevent myself from getting pneumonia. That is really and truly one of the biggest, the focus or biggest things that physical therapy in the acute care setting is focusing upon, is getting that patient up. And it might be up to the side of the bed. It might be up just into a person's chair. Preferably, it would be up to a walker and walking around the room to out in the hallway. In that acute care setting, as I mentioned, we're certainly trying to prevent pneumonia. So the best way to do that is to get yourself up out of bed so that your lungs can work better and work as were designed to do. And another is if you've had a surgery, you've had a knee replacement, you've had a hip replacement. Those patients, they don't actually know how to move. So you do see a light of recognition in those patients' eyes. It's a little more with trepidation though, because you have a knee replacement patient and they're waking up and they know that they've had a major surgery, and now they truly don't know how to move. And so you would be expecting, if you were in the acute care setting today, from your physical therapy appointment, to learn how to move that joint that's just had that surgery. If you haven't had a surgery and you are just in the hospital for multiple other medical conditions being treated by real doctors there, then you're going to be expecting that you're going to get up out of the bed, because we're going to prevent you from having pneumonia. And to do that, we need to get you up into an upright position and preferably to move. All right, so that's in the acute care setting. So the last setting that I'll talk about, because it's the last one that I really have familiarity with, is in a skilled nursing facility. In that form of setting, if I was having physical therapy today, what my expectations would be is kind of a merger between what I would be expecting for the home health setting and the acute care setting, because that person in skilled nursing facility, they've got really a foot in both locations or in both settings. So for that patient, you're going to be expecting that your physical therapy is going to involve you, one, getting out of bed, because we also need to get you moving, because again, pneumonia is a big issue for those settings as well, because a lot of times those patients in that acute care setting and that skilled nursing setting, they are a little bit sicker and they don't want to move. They want to stay in bed. But staying in bed, that's how you're going to get, your lungs are not going to work well, you're not going to cough things out, and you're going to be more susceptible to pneumonia. So getting you up and moving is going to be what you would expect to do today if at your physical therapy appointment, if you're in a skilled nursing facility. We're also going to try to progress that movement in a safe way. A lot of times that's going to involve getting that person up into parallel bars. Maybe they're not ready to walk with a walker yet, because because it moves, it's going to be a little bit more unstable. So we're going to get you up into a set of parallel bars. If even walking is not the best thing for that person, they're a little bit weak and they're unsafe in that situation, then maybe we're going to get you up onto a New Step machine. New Step is a great device because it doesn't have the full function that a recumbent bike would, but you're still able to pedal, you're still able to go back and forth. It's a seated machine, so it's going to be safe, and so we're not going to have to worry about you having a fall on us or something like that. So I would say a big focus on, in that skilled nursing setting, I think a big thing for your expectation for your physical therapy is we are going to get you moving in a safe way so that we can get you progressing and, Lord willing, get you upright and actually walking. So that's going to be more in that skilled nursing setting and what you should be expecting of your physical therapy today. So I hope that this has given you a little bit more of an insight about physical therapy as it may relate to you and whatever setting it is that you may be in or that one of your loved ones may be in. If this is seems to be a channel that seems to be providing some information to you that might be beneficial to you, then I'm going to ask you if you would subscribe to this channel and help us to grow this base and network of folks, so that we can reach out and try to help as many folks as we can who are at some point on that continuum of health that is involving physical therapy, whether they are in that more sickened condition, that, like I say, in the hospital skilled nursing, or over an outpatient or even in home health. So I hope that you, as I say, please subscribe to the channel to get that type of information. And if this video has also helped you, if you could also hit that like button at the bottom, because that also will help us with this YouTube algorithm. All right, I hope you all have a good rest of your day, and look for the next post or the next video that I'll be posting to this channel real soon. All right, thank you so much. Y'all have a good one.